Okay, the second episode in the pathology station, pseudomembranous colitis. Okay, and in this episode, in this lecture, we are going to start to discuss the questions that will show to you in the station and the ideal and perfect answers that you need to say to the examiner. So you will say them, you will not write them because there is no time. Okay, so what is the first question that will show in this station? They will ask you what are the causes, or what is the cause, or what are the causes of this disease, pseudomembranous colitis. And actually, when they ask you about the cause or the causes, you should include, especially if the station is the pathology station, you should include the pathogenesis, because some of the examiners may ask you what are the causes and pathogenesis of pseudomembranous colitis. This is a great examiner. All of them are great, but he's a clear. He wants to make things easy for you. But some of them will ask you only what are the causes. Okay, so we will answer this question and give you the perfect answer. So the answer here is that the causes, which is the first part of the answer, the main cause of pseudomembranous colitis is antibiotics. Okay, it is the use of antibiotics which will lead to the death of normal flora. Okay, and the death of normal flora will lead to the overgrowth of Clostridium difficile. Okay, so this is not a microbiology station, so they will not ask you about what is Clostridium difficile and these things. But there is only one thing that you want to know, just for your understanding, because you know, when you understand the answer, you will not need a long time to remember it in that stressful condition in the exam. If you understand it, it is an algorithm and you can recall it and say it easily. Okay, so the main cause is antibiotics. Okay, antibiotics, not Clostridium difficile. Clostridium difficile is a result of the presence of antibiotics which will kill the normal flora, and when the normal flora is killed, this will lead to an overgrowth and colonization by Clostridium difficile. So you may ask me, why do Clostridium difficile do not die by antibiotics like other flora? Because it is normal flora, it is there also. It is in the intestine with the normal flora. And the reason is in the name here. It is Clostridium difficile. Difficile comes from the word difficult, and it is difficult to kill. Okay, that is why it survives antibiotics. Okay, well, this is the answer for the cause. But as I told you before, you want to include the pathogenesis in this, especially if he do not ask you what is the cause and pathogenesis for this illness. Okay, so this is the first part here in the answer of the question, why do pseudomembranous colitis develop? The second part, which include pathogenesis, this is answer question number 1, is the second part, which is concerned about pathogenesis. Okay, so in pathogenesis, what happens? We stop there at Clostridium difficile, right? Okay, so Clostridium difficile, how does it colonize? How does it cause the disease here? Because it is in this case, it is the direct cause. The indirect cause and the primary cause that triggers the illness is antibiotics. Antibiotics causes kill of the normal flora, and the normal flora, when dies, gives an opportunity for Clostridium difficile to overgrow, right? So now the remaining steps of the illness will be due to Clostridium difficile. That is why you have to mention them all. Okay, so Clostridium difficile will release toxins. And these toxins are of two types, either A or B. Okay, which one is more dangerous? It is B, because it is a cytotoxin. A is also dangerous, but it is less dangerous than toxin B, because it is an enterotoxin. Okay, well, there is a toxin released in the intestine so that an inflammation will develop. Okay, and just to know, this is an acute inflammation. It is an acute type inflammation. Okay, well, so now we reach the point that there is a toxin, and this toxin led to an acute inflammation. So in pathogenesis, we will describe this type of inflammation that happened. From the beginning, let us be here, take the things through the easy way. Okay, inflammation or acute inflammation means that there are neutrophils that are included in this situation, right? Neutrophils. So the pseudomembrane that develops in pseudomembranous colitis is directly related to this inflammatory response, and it is directly related to the neutrophils that are released from the crypts of the intestine. Don't forget that. Remember this information. The neutrophils come from the crypts of the intestine. So what do these neutrophils do? These neutrophils, which are inflammatory cells, acute inflammatory cells, okay, they spread through the line of the mucosal lining of the intestine. If this is intestine, okay, this is the mucosal intestine. So they accumulate like volcanoes, you know, like volcanoes. They make volcano-like structures throughout the mucous membrane. Okay, as you know that neutrophils, when they die, they develop pus, right? I will show you why did I say this information now. But these volcano-like structures are called volcanoes, just to remember this word. Okay, this is pathognomonic, okay, for the illness. Volcano-like structures, these volcanoes in the intestine, are pathognomonic for pseudomembranous colitis. Okay, they spread all over the mucous membrane of the intestine, and this is a membrane that is called muco, purulent, pseudomembrane. Okay, it is pseudomembranous colitis, so it is a pseudomembrane that it is not formed in the normal and natural way by which the membrane is formed. It is formed of mucus, and it is formed of pus because of the neutrophils. So it's muco-purulent pseudomembrane. So this is the answer, the perfect answer for this question. What are the causes, or what is the cause of pseudomembranous colitis? Okay, so you started with the primary cause, you passed through the secondary cause, and then you went to the pathogenesis of the disease, which will lead to the disease. Okay, I will make you a small or a short algorithm that will be like a paradigm for you, and you will remember it in the exam in that stressful condition. So first of all, it will start with antibiotics. Okay, this will kill the normal flora. Okay, this will increase the growth of Clostridium difficile. Okay, Clostridium difficile will release toxins A and B. This will lead to inflammation. This inflammation will lead to volcano-like eruptions, and these volcano-like eruptions will lead to the pseudomembranous colitis or the mucopurulent pseudomembrane.